Hello everyone, hope so all of you are fine and welcome to my channel. In the previous videos we were discussing about wrist flexion. Now we will continue the same lecture in this video. Now we will discuss wrist flexion in grade 2 because we have discussed about wrist flexion in grade 3, 4 and 5 in the previous lectures, and now in this video we will discuss about grade 2, 1 and 0. First of all we will discuss about grade 2. In grade 2, first of all we will discuss about position of patient. Position of patient is sitting with elbow supported on the table, forearm in mid position with hand resting on ulnar side. Position of therapist. Support patient's forearm proximal to wrist. Test. Patient flexes wrist with ulnar surface gliding across or not touching the table. To test the two wrist flexors separately, hold the forearm to that wrist does not lie on the table and ask the patient to perform the flexion motion while the wrist is in ulnar and then radial deviation. Instruction to patient: bend your wrist keeping your fingers relaxed. Now we will discuss wrist flexion in grade 1 and grade 0. First of all, position of patient is supinated, forearm supported on table. Position of therapist: support the wrist in flexion. The index finger of other hand is used to palpate the appropriate tendon. Palpate the tendon of flexor carpi radialis and flexor carpi ulnaris in separate test. The flexor carpi radialis lies on the lateral palmar aspect of wrist lateral to palmaris longus, and the tendon of flexor carpi ulnaris lies on the medial palmar aspect of wrist. Test. Patient attempts to flex the wrist. Instruction to patient: try to bend your wrist, relax, bend it again. Patient should be asked to repeat the test so that examiner can feel the tendons during both contraction and relaxation. Now we will discuss the muscles involved in wrist flexion, their origin and their insertion. First muscle is flexor carpi radialis. Flexor carpi radialis originates from humerus, medial epicondyle bicommon flexor tendon, and anterior brachial fascia and intermuscular septum. Flexor carpi radialis is inserted at second and third metacarpal base palmar surface. Next muscle is flexor carpi ulnaris. It has two heads, humeral head and ulnar head. Humeral head originates from medial epicondyle bicommon flexor tendon, and ulnar head originates from olecranon medial margin shaft proximal to third posterior via an aponeurosis and intermuscular septum. Flexor carpi ulnaris is inserted at pisiform bone, hamate bone and fifth metacarpal base. Other muscles involved in wrist flexion are palmaris longus, flexor digitorum superficialis, and last muscle is flexor pollicis longus. That was all about our today's lecture. Hope so you will like my video. If you like my videos, don't forget to subscribe my channel and also press the bell notification button.